Okay, so we are makaukau at this moment for our very first panel session of the day entitled Restoring Regional Health Through Indigenous Practices. Participating with us in this morning's opening discussion, and I'm gonna call them up, and as they come up, if we can all give them a pa'ipa'i lima kākou. We have Aimee Grace, Director of UH System Office of Strategic Health Initiatives. Aimee. Aloha, Aimee. We welcome Program Director of Oulu Āina at Kōkua Kalihi Valley Comprehensive Family Services, Puni Jackson. The Director of Clinical Services and Associate Professor of the Department of Native Hawaiian Health at the John A. Burns School of Medicine, UH Mānoa, Robin Miyamoto. Joining us from the University of Guam, Professor of Social Work, Lisa Linda Natividad. And our moderator for our very first panel, she's the director of the UH Center for Indigenous Innovation and Health Equity, Rachelle Robley.
Aloha? Okay, there we go. Just put it. Aloha kākou. Okay. Testing. Mahalo everyone for coming today, and mahalo to our panelists. I recently became the director of the Center for Indigenous Innovation and Health Equity. Our center aims to advance ancestral practices to address health disparities in Native Hawaiian and Pacific Islander communities in Hawaii and the Pacific. So we are housed under KAMU in the Office of Indigenous Knowledge and Innovation, and also under Aimee with the Office of Strategic Health Initiatives, both under the Office of the Vice President for Research and Innovation. So lots of offices, but today the intentions are to share about Indigenous innovations in the context of health. So we'll be sharing a bit about our center, some of the projects we collaborate on, and what are the broader implications for this type of work. So with that, I'll pass to Aimee to share more about the background of her and the development of Chihi.
Thanks so much, Rachelle, and thanks so much. Everyone hear me okay? Great. My name is Aimee Grace. I direct strategic health initiatives for the UH system. And it's been a great honor to be next door to KAMU and working with Rachelle for a number of years now. I'm a pediatrician in a past life and formerly worked for US Senator Brian Schatz as his health policy advisor. And so my passion is really how do we leverage policy to improve health and advance justice in the world. So I have the privilege of leading our U Healthy Hawaii initiative across the UH system, which seeks to leverage the UH system to improve health and healthcare across Hawaii and the Pacific. We have a number of different projects. One is our Rural Health Research and Policy Center, where we seek to translate community needs into policy solutions to improve health in our rural areas. Another is our Red Hill Registry, where we're seeking to connect impacted residents to services and also to track their health over time. There's also the Ola Hawaii grant out of JABSOM, where we're seeking to help researchers translate their findings into policy solutions. We also have a neat effort ongoing with the VA, a new VA Center for Native Hawaiian and Pacific Islander Health for veterans, and we're leading the Education, Training, and Policy Core with Robin here as well. So those are just some of the projects we're working on, but our probably first baby was this Center for Indigenous Innovation and Health Equity, or CHIHI as it's called. So you'll hear that today. Now my story, I went to, my children are 5th generation on our same street in Mānoa. I went to JABSOM for medical school, John A. Burns School of Medicine. I did my first year community health rotation out at the Waianae Comprehensive Health Center. I know we have some of the amazing folks from there here today. And what I learned when I was out there was that a lot of the health disparities that we see are due to cultural loss. I actually worked with Kamu's mom, Shelly Enos, before I ever knew Kamu. And again, that's what I learned, that a lot of the health disparities that we see are due to cultural loss. For an early medical student, that was like mind-blowing. We think a lot about the pathophysiology of diabetes or hypertension, or even more recently, social risk factors for health, social determinants of health. But this idea of cultural loss being a key driver of why people are unhealthy was really powerful. And Kamu has taught me a lot about that. This idea of when you restore dignity to a person, how do you change their health? How do you change the way they see themselves and the world? And how do you connect them back to Āina? So that was already in my mind, and we met Kamu when he came into the office. And we started thinking about, there's all these amazing ancestral practices that we all know so well. In addition to the Ma'o study that Kamu mentioned by Dr. Mauna Kea and his team, we have Dr. Keawe Kaholakula's work about hula and really documenting in biomedical research the tremendous impact on cardiovascular disease by doing native practices. Some really promising data out of particularly Canada and Australia about native languages and the potential to decrease suicide and improve youth mental health in particular when people are more connected to their own language. We think about some native practices around the nation and how those can help veterans heal from PTSD in ways that are totally different than some of the Western models. So we really got thinking about a lot of those ideas, and we came together with a colleague, Dr. Valerie Bluebird Jernigan at Oklahoma State University, to come up with this kind of vision for what could be a center for Indigenous innovation and health equity at the national level. Long story, but we kind of pitched this to Congress, and they moved forward with it and ended up funding this center at the national level that sits at the U.S. Department of Health and Human Services in the Office of Minority Health. We then applied for this grant, and we were so privileged to get it in 2021. We're now in our second grant cycle, and we've also received funding from an anonymous donor, thankfully, which has allowed us to endow a directorship. Some of our earliest partners were Kōkua Kalihi Valley and Ho'oulu Āina, Hau'oli Mauloa Foundation, Chaminade University, the John A. Burns School of Medicine, Department of Native Hawaiian Health, Ma'o Organic Farms, Edith Kanakaole Foundation, and a number of others that are really Aina-based practitioners. As a health person myself, I kept saying, well, shouldn't we have more health people at the table? But it really was a wonderful reorientation for me to think about that health is on the Āina. Health is in our practices. It's not in health centers or hospitals necessarily, although of course that's important too. So with that, I think I'll turn back to Rachelle to share a little bit more of our context and what we've done in these first several years.
Yeah, thanks, Aimee. So one of the first projects that we worked on was a landscape analysis. So we conducted a survey with about 50 different Native Hawaiian and Pacific Islander entities that varied. Most of them were nonprofit organizations and academic entities. And the goal of that survey was to understand what are the gaps and opportunities in researching Indigenous innovations in health. We also conducted several interviews with system stakeholders from University of Hawaii and state agencies to learn about the different systemic efforts to support these types of initiatives. And so from that analysis, we got lots of different themes, but three of the major common themes that probably will not be super surprising to you all is one, which is that there needs to be an understanding and an acknowledgement that both historical and modern day injustices have led to systems of dependency and sickness, and actually not just in the human health sense, but also in environmental health. The second is that there's a need for co-leadership between community and government agencies. And so obviously we've all seen how in various ways communities are left out of major decision-making processes that are made by government, and also that communities have a lot of knowledge and experience that could really inform how those decisions are made so that they're more effective in the end. And then the last and probably the most important, which Kamu kind of talked about, which is that there's a lack of infrastructure for these practices and the perpetuation of these types of knowledge. And what that means is that at a very basic level, it's kind of difficult to talk about researching these types of really amazing, innovative initiatives when many of the people leading them, like cultural practitioners, community organizations, continuously struggle to meet basic needs like providing appropriate compensation for practitioners and gaining access to land and ocean to just do these practices. So those are kind of the major themes. And obviously, there's many ways that people are working on Indigenous innovations in health, but hopefully that gives you a sense of where our center focuses our lens. And so with that, we have three major strategic priorities. One is uplifting these types of research that are already happening. The second is expanding policy initiatives that support the infrastructure for long-term sustainability for these types of initiatives. And then the last is an investment in next generation leadership. And our hope is that in all of these spaces, we're convening community, government, academia for that type of co-leadership that was identified as a need. So that's a bit about our center, and with all of that, we can kind of get into the panel discussion. So maybe Lisa, Robin, and Puni, each of them are some of our project partners. If you all can share about how you're working to restore regional health through Indigenous practices through your Chihi project and any other relevant initiatives. Lisa, do you want to start?
Sure. Buenas and Hofade, everyone. I'm Lisa Natividad from Guam. I work with the University of Guam. I'm cross-faculty in the Division of Social Work as well as in our Chamorro Studies program that we have, which is our Indigenous people. And so just consistent with Kamu's sharing of his genealogy, I wanted to share that I, too, am a product of the Mānoa system. And I just, of course, as people from Guam, from Micronesia, the University of Hawaii is kind of the big campus to come to within our Pacific American context, and so that brought me here. But I also wanted to share that for me as an Indigenous person rooted in our own traditions, I felt the most home here in Hawaii, in Waianae. And so having been a product of the social work program, I actually did my field placement in Halenaupono in Waianae, and I spent quite a bit of time there. And it felt the closest to home in so many ways. And so I think in terms of kind of bridging to the Chihi project that we formulated, so I work at a university and then I also do private behavioral health practice. And part of our study almost 30 years ago here really explored the idea that the models that we were being taught really didn't fit. You know, it's as though the shoes that we were being trained to wear just did not fit our feet. And so the first default is, okay, so let's reject those models in some way or take whatever of it is useful, but then really gave rise to the question, well, then what do we replace it with? And so I think part of that in terms of our kuleana and for us, our obligation to help our people is to then move into the spaces of developing then what that new thing looks like, and new to the degree to which it connects with the deeper sense of who we are. And so our Chihi project is connected to, in the therapeutic realm of behavioral health, giving rise to when we work with populations. So most consistently, we have intergenerational trauma. In our case, in Guam, we were active war zone in World War II. And of course, just all the culture loss that Aimee was talking about. Our colonization began, our first contact with the Western world and our islands was in the 1500s. So Hawaii had 200 years more of isolation from colonization than we had. So you can only begin to imagine how deplete a lot of our traditional systems were because of that. Not that hope is lost, because it's not, but part of what we're doing in our project is we're looking at how do we reconstitute the self in terms of repair from trauma experiences and the lived experience, as well as what's been inherited intergenerationally. And so our main premise in terms of our work is looking at our traditional spiritual healing practices throughout the Pacific, in terms of connection with ancestors and using traditional practices like ho'oponopono. In our tradition, it's called inafat maulik, to make good again, as we move forward in terms of healing our people and healing ourselves through these projects. Thank you.
Aloha. I'm Robin Miyamoto. I'm a clinical psychologist by training, and as I was reflecting on Kuha'o's opening this morning, I changed my introduction a little bit. I've been working in Hawaiian communities for 25 years. I'm not Native Hawaiian. I'm fourth generation, or Yonsei, from Japan. And I come from a really big family of servant leaders. My father was born on December 2nd, 1941, and he and my grandmother were in Queens Hospital when Pearl Harbor was bombed. My grandfather didn't know if they were going to be safe, but his response was to jump in his car and drive to Pearl Harbor to help because he was a physician. Unfortunately, he was turned away because he was Japanese and they weren't going to let him on property. But I think that story has always stuck with me, and his message to all of us has always been one of responsibility and relationship. And so Kuha'o's question this morning of how do I deserve to live here is one that I ask myself regularly in terms of serving community. And so when the Lahaina fires happened, I was actually in Puerto Rico for a Robert Wood Johnson fellowship opportunity, and I got on the plane and we were just starting to hear about the fires, and I got off the plane and heard about the devastation. And so our project is looking at combining cultural practitioners with behavioral health service workers to serve the victims of the Lahaina fires. And in the days after the fires, I was working with Hawaii Psychological Association, really thinking about what was the behavioral health response going to be. And we were expecting, huge amounts of people to need traditional, behavioral health counseling. And Keola Chan from Ahakane and Kapau Lonapuha reached out to me and said, can we work together? He had cultural healers, Lomi practitioners, and Ho'oponopono practitioners who were being kicked out of the Red Cross shelters because they didn't have the credentials that the federal government would recognize to allow them to be providing services there. And so we talked about how we could work together to provide services to the folks of Lahaina, and it was very much volunteer at the beginning. Just people giving up their weekends. Everybody had full-time jobs, flying over to Lahaina on the weekend. And so sustainability definitely is one of those questions that we look at, because we know that with the cultural loss and the land loss in Lahaina as the first kingdom, the first capital of the Kingdom of Hawaii, that this recovery is going to be long, and we can't depend on people to do this as volunteer work. So we set up our tents and had behavioral health and Ho'oponopono folks sitting together in the tent, and nobody came to talk to us. Nobody was ready to talk. But the Lomi practitioners had their sign-up sheets full and lines waiting because everybody needed a Lomi. And so we pitched in where we could, and we were on standby because for so many people, they were holding so much of that trauma and hurt in their body that as soon as somebody laid hands on them, all of that started to release. And the Lomi practitioners were like, oh, I don't know what to do with this. Like, it's a lot. And so we were there for that warm handoff to be able to provide kuka, because we couldn't do traditional ho'oponopono, but just, talk story sessions, have behavioral health folks there, both to support the survivors, but also to support the cultural practitioners because they were overwhelmed. And we did some education about red flags and what should they be looking for. We talked about community resources and how to get folks there. And so that really allowed us to start to think about what long-term recovery was going to look like in Lahaina, and now we're focusing on building a system that will provide a healer in every home. So it's not about us having to fly over on an ongoing basis, but about folks learning how to do the healing within their own families, and that home is going to be wherever they are and wherever that healing is happening, because they're having to transition their housing so many times as some of them are still in hotels to this day. So that's our project with Hui Ho'omalu.
Awesome. Mahalo. Puni.
Aloha, my name is Puni Jackson. I come representing a community called Kalihi. In the back of Kalihi Valley, I work and was part of the creation and founding of a project called oulu Āina. And I see a lot of people in the audience who are familiar and feel like family to that place. We're part of a federally qualified health center, Kōkua, Kalihi Valley. And those of you, I saw a little bit of nods of heads. Those of you who are familiar with our director, his name is David DeRoff, know that there's an advocacy and connection, a partnership that creates a certain sovereignty in that 100 acres that allows for great creativity, great listening, deep care, and I'm really excited to hear, Kamu, you say that innovation is an audacious word, because as far as we know, innovation is not new. So on that 100 acres of land and in that community of 50,000 people, we are a welcoming place of refuge for people who need that connection to Āina, to community, to La'aulapa'au, definitely to Lomi Lomi, but in integrated and partnership and braided connection to the health services of a colonial structure that we have become familiar with and are most equipped to be able to respond to colonial illnesses. Chihi has been such an important partner for us because while we're able to navigate with sovereignty and relationship, the telling of that story is not easy, especially within the context of maybe the relationships that have brought us to this room. Oftentimes we understand very clearly what works in our community, what is important to our longevity as people, as a world, and yet the telling of that story requires an extractive narrative that is sort of a data process that can be so linear that we forget that our innovative processes and practices of our kupuna are not in service to the wealth that we aim to gain for ourselves in the future. And in fact, Āina as center, Āina as relationship, Āina as family is not just the input so that we can survive, but it is in fact the place where we put our mana and our wealth and our resource and our time and our energy and all of our mo'olelo, all of our future generations back into that center. And so I'm really grateful to be invited to the panel and to be invited to the advocacy to change research, to push on the edges of what we consider to be advocacy for the health of our lahui. Mahalo.
Awesome, mahalo. Okay, so Lisa and Robin, you both have clinical training as mental health providers, and I'm curious to hear your thoughts and experiences with seeing how the incorporation of Indigenous practices has been effective, but maybe even essential in some cases in terms of improving health outcomes in our communities.
Sure, thank you. And so, you know, as I was sharing earlier, when you go into the field of behavioral health, the majority of the training you receive is very Western-centered. And so even what I've come to learn, even as a professor in the classroom for our regional folks, meaning situated in Micronesia, even the very first steps in terms of what you teach, right, from these books that are Western inherited are completely misaligned with the very source of who we are. And so I think from what we've come to see is that the most important first step is the alignment of our traditional values and how we behave and how we engage and see the world, our worldview, with practice. And so I had one situation in the classroom, and it just was so starkly eye-opening for me. So we were doing our usual simulations of counseling and so forth, and I had a student who was from deeper into the region of Micronesia, very little contact outside of the region before he came to our university for school. And even the situation, the way the chairs were situated in a role play were completely inconsistent and uncomfortable for him. And so, you know, it was something that really needed to be highlighted, because something that is such a minute issue in terms of our engagement and working with each other was problematic. And so it's really kind of forced us to go back and say, okay, what is a more appropriate use of space? What is a more appropriate and aligned way of how we relate to each other? And that really, I think, is at the core, because what the research does show in terms of outcomes of behavioral health is that engagement is the most critical factor. And if we're not able to engage our client systems at the very beginning in terms of how we can connect as human, you know, as one person to another, then that's a precursor to the rest of the working relationship, right? And so using and switching to more of that, what's natural for us in terms of our indigeneity and how we connect with each other, is really, really critical. The earlier video that was shown of the oulu, we're actually using something similar in the curriculum that we're developing. We have a lesson specific to connection with community. And in our context in Micronesia, when we do the fish run, in this case, we call it a tulai, the tulai runs. And so the entire village goes out to connect the fish, right? You got multiple boats go out, we get our fill for what we need, we bring it back to the shore. The village arrives and greets you at the shore, and we all pati, which means equally divide the harvest, right? So that connection to community is so paramount and so basic and foundational in terms of who we are, that if that's not reflected, those values are not reflected in our therapeutic approach, then we're really not going to be very effective.
So I think, you know, as Puni was mentioning, the community health centers have been doing this for a long time. And I started my training at Waimanalo Health Center and worked with Kawaikapo Kalani Hewitt in their cultural healing department. And the engagement that Lisa's talking about is key. And so I would, you know, see patients during the day that were coming into clinic, and then I would sit in the waiting room for Lomi and Ho'oponopono in the evenings and just talk story with the folks that were coming in. And they were coming in for chronic pain, they were coming in for diabetic neuropathy, but that was really the opportunity to talk to them about what they were doing to take care of themselves and maybe do a little education about diabetes management or healthy eating. And I think taking that same approach and applying it in the work that we're doing in Lahaina, because people don't always get help in the traditional 50-minute psychotherapy hour. It's not about coming and showing up for an appointment and talking about something for a finite amount of time. It's really been about building the relationships. And Hui Ho'omalu, the group of healers that we have, we wear these green dry fit shirts that just have block print Hui Ho'omalu across the front. And we're recognizable from the time we get off the plane, and the ACE rent-a-car van that picks us up, and we're talking to the people there. We had one auntie that came up to a group of our healers and asked if they were a bowling team. But it started the conversation, and then the very next day she was there at the workshop that we were holding. So it's that community work and the idea that the healing is happening in the interaction. It's not happening in the hour. And I think that's the piece that I'm so grateful to Chihi and the Innovation Center for supporting that, because it's not necessarily reimbursable by the insurance company, and they support the idea of what we're doing and that this is going to be a long-term recovery. I think, you know, folks don't understand the mistrust that's there. A lot of the trauma that has happened in Lahaina is not from the fires. It's from the interaction with the federal workers. It's been bad. And that's the piece that we're working to overcome. And I think even as folks from Oahu coming to Maui, there was mistrust there. Like, who are you and why should we talk to you? And so recognizing that and that it takes time to overcome that. I think, you know, with Aimee's piece talking about policy, we now know that we have a knowledge base to be able to talk with the federal government and say, this is how we choose to be interacted with. The next time that this happens, and there will be another wildfire disaster or something because of climate change, we want to be prepared and we want our community to lead the charge. And this is how you can support that, and this is how you can interact with us. And this is how we know we can minimize trauma by deploying community health workers alongside FEMA workers so that it's not a 10-minute cultural competency training that's provided to FEMA workers. It's working side by side with community and understanding that folks need to be there for the long term. You can't turn them over in 2 weeks. You can't ban music in the hotels because that's how healing happens. And so I think that piece of things is, how do we take this experience, continue to heal the community, but then how do we change policy so that we can change the landscape of how this happens in the future?
Awesome. Mahalo, Robin and Lisa. And I want to pass to Aimee and Puni. You both have extensive experience supporting with various systems change initiatives. Puni, through your partnerships with various state agencies and health insurance companies, and Aimee, through all of your federal policy work. And so it would be great to hear thoughts from both of you about how you see the potential for Indigenous innovation impacting broader society, and also maybe more critically, how can current structures better support Indigenous innovation?
Mahalo. Yeah, I'll start. I actually want to go back to what Kuhao said again, which is, how do I deserve to live here? Which is such a beautiful way to remember that we are here. And the idea that we've forgotten to, that's an easily forgotten concept, especially in academia, especially in economics, especially as we navigate our world. And so, this idea that innovation that is indigenous is sort of this ancient concept. It is continual. We are still here. O Hawaii ku kilohana. We are here in this place. We are accountable to this place. We will continue to always make choices with that mindset. And I think when we talk about systems change and system impact, it's always a really great win. Like, oh, okay, so the insurance company is now reimbursing for la'aulapa'au and lomi-lomi. It's a huge win. And yet, like, why would that be what we're begging for? You know, we should actually design our whole system around a health concept that centers lomi-lomi as our most important, or centers Āina as our most important. So first, I would like to think of Indigenous innovation as central to the place. I mean, the concept of indigeneity in itself is that we are here. And then in partnership, I think relationship is so important. It's really easy to, I use the word colonial more comfortably than I think a lot of people are comfortable hearing. But I think it's really great to not think of things in the binary, but to understand that I am the descendant of my own colonizers. I am responsible for those in my genealogy who are here because of very selfish and extractive reasons, and I have responsibility to heal that within my genealogy, in my daily work. And so systems change might be about working for the DOE, getting the kids on the Āina. I see Kauai in the room, getting our vai as part of our learning, and it is personal too. That is, we are accountable in every way. And I think that oftentimes when we look to the personal, especially if we've been educated within the systems that exist currently, we see that innovation is often in service to dominance and the prowess of our our CV, maybe, our research agenda, how published are we? And so I just want to kind of put that out there and say, it's really easy to think that we're doing this in service to the world and yet behave in ways that are in service to the individual. And so I really, as a representative of community, humbly say that we can make those choices on a day-to-day basis to make sure that our system's mindset is really about the collective and accountable to the collective that is generational, that is cultural, that spans space and time. And I guess the last thing I'll say is that it doesn't matter, and actually Kuha'o already said it doesn't matter who you are. If you're here, then you have kuleana. If you drank the water, you would flush the toilet, then you have kuleana. And I'm someone who is ono for kuleana. And I love a young one who is ono for kuleana. And be ono for it. Know when you're accountable to resource, know when you're moving resource, know when you have, maybe the resource is your mind, your hands, your pocketbook, your relationships, maybe you have your vote. We are here. We are here. We are still here. And so our sovereignty is in our behavior in every moment, and how we align our resource to source, I think is the most important part of the system's conversation around innovation.
No, thank you so much, Puni. I love that. And really a lot of my story of moving from a physician to really a systems thinker and a policy person and being in the weeds of budgets, which seems kind of boring, but it's actually where a lot of the rubber meets the road, is precisely because of that. How do we change systems and structures so that how we interact, how we engage, what we prioritize is more prioritized by the system and not just on a one-on-one basis, as critical as that is too. So something that Kamu has talked about a lot, and he included this in the how will we know, is how do we ensure that there's ongoing investment in communities? How do we ensure that there's operational support for a lot of the traditional practices that, as you've heard across the board, are so powerful? Not just one practice or another, but across the board. We heard stories of, like Robin said in Lahaina, of practitioners spending their weekends, right, after a full-time job, then going to do a lot of their traditional practices. Or we've heard stories of how hard it is sometimes to put food on the table or pay for your housing when you're trying to also keep up a lot of your traditional practices. Why is that? Why are we not valuing as a society a lot of these traditional practices that are so critical to our health and to our well-being, both of the Āina and of the people? So when you think about sustained operational support, that usually means funding. So what sort of funding is stable? How can we try to work and advocate towards to get to a place where there's more funding for a lot of these projects? So I've turned into more of a budget person because that's really kind of where a lot of policy happens. So when you think about stable funding, we can think about the state budget, right? So there's that saying that there's nothing certain in life other than death and taxes. But taxes, we have our state budget is born of all of our taxes. And that's pretty stable funding when you think of getting a state job or you think of having a line item in the state budget. And so that's one of our projects within Chihi, is we're doing a deep dive on our state budgets, state agencies, looking at where are there pockets and opportunities to propose that, hey, maybe we need more Aina-based educators in schools. Maybe we need more traditional practitioners in prisons, right? Where are these pockets of places that we can work together to see if there are opportunities to put more positions, more funding towards supporting Indigenous and traditional practices in the state budget? So another place we're looking at is reimbursement. As you mentioned, it's a small thing, but in the health insurance world, there's a lot of, if practices are reimbursed, they become stable. So we want to think about how do we try to incorporate various practices into reimbursement models. We also want to think about federal streams of funding. So grant programs right now, as probably many of you know, you have to kind of keep reapplying every year, 2 years. How do we make those both more available, grant programs, but longer term, 5 years, 10 years, that recognize an investment in the community in the long run? We also think about ourselves at UH. You know, we're blessed at UH to bring in over, last year, $600 million from extramural sources. How do we think about, and this is what we've already begun doing in a lot of ways, better engagement with the community in that process? How do we ensure that the jobs that are created are going back into the community and are helping the community retain a lot of the practices and champion those practices going forward? So those are some of the categories of areas that Chihi is working on. We're investing directly into a lot of community projects that are themselves phenomenal and making change. And we're also investing in some of the opportunities to really dive in and put out reports and studies about where we think investments should be made, if you are policymakers or others, about what you can do to basically make traditional practices more central in our budgets and in our priorities and in our systems.
Awesome, thank you. So we'll be wrapping up this part and moving to Q&A soon. But before that, are there any kind of closing statements or final thoughts that any of you would like to share before then?
I was reflecting, sitting in the audience this morning and thinking about innovation, and President Lassner's talk this morning, and I wish he was here, but I would want to challenge that when we think about innovation, I would love it if we didn't have any more national searches for positions in Hawaii, that we were building capacity from within. And the next time that there is a space in leadership, that it is an Indigenous person who is put into that, and that we come together to build that. And my argument is it's already there. We just need to get people to recognize it. We don't need the expertise from the continent. It's here. It's in this room. This is where we are. And that's the innovation that we need. This has been a hard week for a lot of people. And Keawe Koholokula, the chair of our department, sent out a message to try to just pick people up. And he reminded us a quote from the pole navigator, Papa Mau. To navigate, you must be brave. You must remember. So let us be brave and remember the resilience that we have within us that's needed to come together to successfully navigate the future.
I guess I have this thought in my head, and I see Keone in the audience here, but a friend of mine kept saying over these last few days that the trees are calling the clouds. And the idea that if we are able to really go down and root deeply in our work, in our communities, in our knowledge base, and we move from kipuka to forest, then Lono comes and Kane comes. And so I guess I would like to inspire, I am inspired to be a tree that calls clouds, and I would like to invite us to be forest.
It's interesting for me because our homeland is much more isolated, even further than Hawaii is, and in so many different ways. We're much more isolated, and in some ways that's limiting, but in many ways it's very protective. And so I just want to offer, particular to our Hawaiian community, that when we talk about innovation, for me, what comes to mind is closing your eyes, and connecting up. Because in the place where we were talking earlier about the week in the United States context and how challenging it's been, and I shared that as a person who's an Indigenous person of a current modern US colony, we don't even have the opportunity to vote, and how dehumanizing that really can be and disempowering. But when you look up, regardless of all the culture loss, there's so much beauty. And because of connection to ancestors, so much of what's lost is very easily gifted back. And we need to remember that and center that. And that, to me, is the most important form of innovation that occurs in our work. It's to connect to the deeper sense of who we are, because it's not gone. And I just want to offer and put at the table that, or at the mat for us as Pacific, that there's a lot of very deep Pacific Indigenous wisdom that continues to exist throughout our entire region. So while our being situated and embedded in a larger colonial context in our homelands, it doesn't mean that there isn't very independent rest of the Pacific that really are wellsprings for all of us. And so I just wanted to share that. Thank you.
I think all I would say is, I've learned so much from all of you, and I'm really honored to be here, and of all of you, and that we're all family, we're all ohana together, right? So let's work together. If there's anything that any of you, and let's all bring our collective, what we have, to the table, and we would love to see, if you're an educator, a policymaker, a community practitioner, anyone that wants to work on this movement together, we're just excited to have the opportunity to have this center at UH. And again, thanks to Kamu and thanks to Vice President Sirmos for helping to support that. But we want it actually to be more in the community than it is at UH. But we're hoping that it can be some sort of convening point for those that are interested as well. So please join us. We would love to partner with you.
Yeah. Okay, thank you all so much for your time today on the panel. I know you all work several jobs, so thank you for fitting this into your schedule and for all of the amazing work that you do. And yeah, like Aimee said, if anyone in the audience is interested and resonated with the ideas and concepts of either of the speakers or Chihi as a center, you can reach us at Chihi or CIIHE@hawaii.edu. We also have a website, so you can look that up too, and always excited to partner. Okay, so with that, if we could give a round of applause to all of our panelists. And then we do have a few minutes if there were any questions or thoughts that anyone in the audience wanted to share.
Oh. I'm sitting. Can you hear me?
Yeah.
Okay. I'm sitting right by the mic, right? So I might as well. But I'm sorry, I forgot your name already, but when you talked about the loss of culture being the loss of health, I mean, I was not prepared that I was just going to burst out in tears. And I've been sitting here crying ever since. And I just want to thank you for that.
To start with the processes, I'm not from Hawaii. I'm first generation born in America because my dad joined the service in the Philippines when they were drafting then. With that being said, I am a UH Mānoa ED candidate, working on my dissertation to figure out how to integrate Indigenous practices in a Western clinic. To further advance that, I have my doctorate degree in physical therapy, and I have my own clinic on Molokai. With that being said, and given some of the gifts that I have learned that I'm still learning, I should say, and learning different Indigenous practices of being spirit, the difference between a lot of Western models of Western medicine practices and Indigenous practice, the only difference is spiritual. So for some of you guys, knowing that and seeing how it's been defined and shared, to see that it's so separate, to say that you had to create different booths or different spaces, or how it looks, it's different for people of Indigenous practices of how they do things. Maybe this isn't a true question, or maybe it's something to just ponder, but can Indigenous practices really integrate? right? Or is it something that is supposed to build our own foundations, you know, or if you're saying that we're supposed to have a healer in every home, then you're saying that it's not supposed to be in a business practice. Right? Because then it's not reimbursable if it's in the home. Right? So there's the conflicts of what I hear. But again, this is my journey as well.
It's such a good question, and it's something that we deal with every day. And I think the question brings more questions, and there's really great questions to ask yourself. Where is the power in the room? Where is the power in your own practice? What are you investing your power in, and what power are you growing? So basically, you have to know that before you can use any word that you're going to use. If you're going to use the word integrated, is it like, oh, I'm making a cake and I'm going to crack some Hawaiian and put it in my, I'm integrating into my batter just a little bit of spirituality. If that's where you're at, then you've decided what is centered to you and you're adding something else. If in your home, your power is family and building ho'oulu mana of that ohana, that the ohana is the practice that you're going to perpetuate, you've created what your center of power is. As a community in Hawaii, which is why I'm like, we are here, don't forget where you are, you know, that there's a really easy way to think that you're in America. It's really easy for us to lament what is happening in this moment in time, historically, as if this is America. And so I'm just going to let that, a couple moments. And so similarly, do we need 2 tents? Yes, we need 2 tents, because people think that they're not here. They think they could be anywhere. Those tents, the separation, the palena, paleana, the boundaries allow us to protect that which is sacred. And so those who are welcome and ready to be part of healing practice, that you draw on wherever your kumu and lineage comes from, that healer in that practice is responsible for all genealogy of knowledge and practice. And the integration is you, the braiding, the oneness, the wholeness, because the healer brings wholeness, is part of your own resolution, a resolve around your own genealogy of practice. The answer is not external. The answer is where your power is.
Yeah, so it's interesting because there's so many pieces that are woven together. And I think, you know, for us, when the fires happened and, you know, when we look at how traditional healers are spread out across the state, Maui has fewer when we compare to other islands. And that was one of the reasons that Keola felt a kuleana to take folks from other islands and bring them to Maui. And there was even a question then of, should we do that? Because maybe that's not okay. And then there was a question of, you know, there's federal law through Papa'olalokahi of who is recognized as a healer. And it's the Kupuna Council that determines that. And the Kupuna Council hadn't met for a long time. So folks who had received training didn't necessarily have the official, you know, notice. And so we had to bring together, and Rachelle was just with us when we brought all of the haku, all of the teachers together, who gave permission for each of their students to, yes, go out and work with Hui Ho'omalu, which is this collaborative group. I think from a healthcare system standpoint, like that is the center because that's the payment structure that we work in. And then there are those of us that are trying to integrate in that way, maybe of the cracking eggs into. But I think there are other places that is the center, and we want to be able to create more and more spaces for those opportunities. The healer in every home is the idea that there are traditional Hawaiian practices that people are doing every day in their life. They just don't recognize it sometimes as being a traditional Hawaiian practice. So when I do diaphragmatic breathing with a patient in the clinic that I work in, that's actually hanuha. right? That there is traditional practices. We had a workshop with a family, and the mom was really reflecting on it, and she comes from a long line of kahuna, and she said, like, our family practice, like, we need to go back to pule, because we recognize that we may be called upon to do that, and I want my children to be able to practice that. So recognizing that, and that we don't have enough healers readily available within community, and so creating that idea of a healer in every home is there's a lot of things that can be repaired with that peva in the home, and it doesn't need somebody from outside to come in to do that. And we just are working to build that network.
Did you have one?
I had a quick one. If I
Okay.
have time, I can. Okay, cool. Thank you so much for your panel presentation. I think we've talked a lot about a very important point on how if policies can become reimbursed, or sorry, if practices can become reimbursed, they can become stable. And how, without the financial support, a lot of what we're talking about is hard to actually be actionized, acted upon by the people that are actually doing it. This isn't a very sexy topic, but insurance. I think we've kind of talked about around insurance, but I'm wondering if there are Indigenous frameworks for something that exists very ubiquitously in our current medical system that we can really rely upon for kind of reframing these practices as with financial support. So just to kind of summarize, I guess what I'm wondering is, are there Indigenous frameworks for things like medical insurance and insurable practices that seem to be kind of the byline of everything we do in the medical sphere? So.
I have something to say about that. We do have an Indigenous framework for health that we use at Kōkua, Kalihi Valley. It was designed maybe, 12 years ago. It's called Pilinaha, and it breaks down, it was designed with and for and in through the voices of our actual community members and cultural practitioners who determined that relationship, connection, pilina, is the basis of all health. And so Pilinaha is a framework. I won't go through the whole framework, but it's used in training at JABSM. It's used in relationship with HMSA as one of our insurance partners. It's definitely not just used, but emphatically perpetuated through the Aloha Care insurance system. And beyond Hawaii, it's also referred to in other medical practices and in public health and policy use. And so this Indigenous framework where relationship is center, relationship is health, connection is health, we have language to be able to cross-navigate. Now, how that makes it fundable is, I would say, precarious. There are contexts and relationships where that relationship is sort of so early that maybe it just seems like lip service, but there is hopefulness in the relationship over time. And then there's the longer term sort of outcomes where that those who are kind of brought up in medical training with this Indigenous framework as foundational are able to switch how they're navigating patient relationships and insurer relationships. For example, one of the Pilinaha trained young medical professionals uses the it's such a specific example, I'm sorry, but uses the framework in order to be able to allow a patient to go home from acute care in a hospital setting. So for example, do you have connection to family and community? Do you have connection to place, land, resource? Do you have connection to your best self? And do you have connection to your culture, your past, present, future? These are conceptual as a framework in a classroom, and it makes perfect sense. But when you're mobilizing it, when you're actionizing it, I like that. Then what happens is that the hospital is actually accountable to not releasing a patient who doesn't have the proper connections for safe release. Now that's impacting from the ground up using that framework that then any insurer who is aligned to that particular framework will be able to justify investment.
Just a quick note, it actually brings me back to public health school where we studied, what is the point of insurance, right? I mean, when you think about it, actually, it's kind of profound that why shouldn't each of us just, I'll just save up some money, and if I ever have a problem, I'll just pay for it. And why shouldn't each person do that? Well, the idea is that the community, we all don't know who's going to get sick. So let's all pay in, and then if someone gets sick, then maybe you need more, maybe you need more. At its best, perhaps, insurance is a form of collective community building. A lot of us know, unfortunately, over time, that hasn't always happened. So I guess, and to your question too, I feel like I love these questions because I feel like we're part of a journey that's been going on for a while, but we're starting to get more to a tipping point perhaps. And I would just say dream with us. Let's all dream together. The systems that we want to exist probably don't exist yet in the way that we want them to. Let's dive in with the federal policy. Yeah, the federal world is getting a little complicated these days, but it's going to look a little different. But there's a lot of ways to weigh in about what should be reimbursed federally, what should be reimbursed at the state level. That you can do that through comments, you can do that through legislation, you can do that through federal appropriations and state level policy activities. So there's also a lot of movement towards value-based care that maybe could be leveraged in certain situations like this, right, where it's not just paying one-on-one for volume-based. Like fee for service, but you're thinking about a more holistic amount of money, and then maybe that can cover other practices. So we're really trying to dream big in a lot of how this actually looks, but we would love to work with all of you in trying to design what at least our proposals would be for the powers that be to make some of those changes.
Right on. Thank you so much for your responses.
Okay, great, thank you.